So, welcome Bologna. Welcome
Felix.
Piero. Great
Yeah.
pleasure to have you on board. So, what you
Felix.
doing with small lesions?
Yeah. Can you hear me? Yeah. Yeah. Felix, thank you for kind invitation. It's a pleasure to see you, and thank you, Pulmonology Unit. We are in Bologna, and welcome in Bologna, Italy, and we are ready for sharing a performance procedure with body vision lung system. We will perform a procedure for a transbronchial biopsy on a peripheral lung lesion. So I am here with a few of my colleagues, my young colleagues of my team, Thomas Galasso and Martina Ferrioli. So we go on for a fast presentation of the clinical case, okay? Please, please, Thomas.
Ok, possono mettere le diapositive.
Fatti vedere. Vai.
Okay, the case is an 80-year-old male, former smoker, affected by chronic ischemic heart disease following a myocardial infarction. A nodule was found. It's a partially solid peripheral lung lesion in the right upper lobe with a pleural base. There is no clear bronchosine CT scan. The lesion was the only site demonstrating significant PET uptake on PET imaging. The SUV, mean SUV is 3.3. We can show you the CT scan. Okay, this is the lesion. It's about 4 centimeters, and it's partially solid. So, the next slide, please. This is the setting with which we will perform general anesthesia. We use an Olympus ultra-thin bronchoscope, the radial EBUS probe, and C-arm fluoroscopy combined with the LungVision platform. And if we are planning to perform a cryo on the nodule, and we also we use an ex vivo confocal laser scanning microscopy, the Vivoscope that we have here in our endoscopy suite, available for an on-site evaluation of the histological sample. So I think that we can proceed.
Yeah.
Yes, we will use the LungVision platform, as I think you all know, is an advanced platform employing an algorithm and an image processing software which integrates the CT scan obtained pre-procedural with the real-time fluoroscopy image. This platform enables a virtual bronchoscopy navigation along with the augmented fluoroscopy and the possibility to perform the tooling lesion function, as we'll see during the procedure. Okay. There are 2 steps in this LungVision system. One is pre-procedural, after we upload the CT scan on the machine. This is the workstation. This is a small tablet connected wireless to a main unit, and the other component that we need is a bed, a radiology bed dedicated with the fluoroscopy dots, fluoroscopy markers. So we can start with the planning. This is the first image that is the segmentation doing by the software. Okay, we confirm. Then we have to select the target on the CT scan. We mark it, and then we have to center it on the multiplanar views, and after that we have to mark it with small dots. We have to mark the periphery of this lesion.
Of the plan.
Okay, I think it's fine. And then we have the target lesion related to the to the bronchia, to the airways.
Yeah.
And then we have to select the airway leading to this lesion. At the CT scan, this lesion has no bronchus sign. There is no the bronchus sign evident going directly in the lesion. So we have choose the closest one. Okay.
Nice.
So we can check for a virtual bronchoscopy before the procedure, but also during the procedure is possible to have a look. So this is the pathway that we want to follow to get to the lesion. So now we can start the procedure. And
okay.
The first thing is to...
We have to mark the carina, main carina.
Yes, okay. Is to perform the registration of the main carina. So, it takes some minutes. Okay. We have already put the fluoroscopy C-arm, okay, on the patient. Okay, so we need to center the fluoroscopy beam on the main carina, and for this the tip of the scope will help us. So with the tip of the scope we go on the main carina, and after we are sure that the carina is centered, we can make the registration, performing a first spin. Quando ci sei?
Accelerato.
So, when the operator is ready, we perform a first spin from right to left.
Okay.
30 degrees right and 30 degrees left.
Now we are ready? Yeah.
We are ready? Okay. We start the spin. We have to perform it slowly and smoothly.
That's okay? Snapshot? Okay.
Okay, now the system is processing the CRBT, that is to say the C-arm based tomography. The real-time fluoroscopy image, and in a few seconds we will see on the display the fluoroscopy image alongside the CT scan, and we have to select the main carina on the fluoroscopy image and match it with the apex of the main carina on the CT scan. Piero, is it fine?
Yes, it's
okay.
Fine. We have matched the main carina on the pre-procedural CT scan with the CAPT.
Then, this step, we have to move the fluoroscopy arm following the advice that the machine gives us, just to put the lesion, the target lesion, at isocenter. So we need to move the C-arm or the bed, it depends, but just to center the lesion. Hai fatto tutto?
Up the bed, 10 centimeters.
So we are elevating the bed.
Okay.
Okay.
Ok.
Tra poco ti conviene venire qua, perché...
Per me no. Per me non è così.
Ok?
Non è così.
Il lettino verso i piedi di 6 cm.
There's the foot. Ok. Su altri 4. Up 4 centimeter, yeah. Ok. Take a look at 2 centimeter more. 2. E 2 in giù. Ok, allora in su questo. Ok, perfect. Take a look.
Ok, bisogna portare...
Ok.
No, no.
Yes,
Okay.
that's okay.
We
Now
have
it's centered.
now the target should be isocenter. So now it's the time to perform the second sweep, the second spin with the C-arm fluoroscopy. Okay. So we can start.
Fai vedere lo spin. No.
Okay.
Sempre un colpo.
Now we have to wait some few seconds for the image, for the fluoroscopy image to be analyzed. And then once again we have the multiplanar view alongside with the CT scan image. And we have to match the nodule on the CRBT with the nodule on the CT scan. Okay.
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 In this way, we can correct the CT to body divergence in real time. This is the movement that we can do if we have to correct the CT to body divergence.
There is an additional function. This is AI Tomo. That is a reconstruction performed by the software. But if we see already on CRBT, that's fine. So this is the lesion and it corresponds to the lesion seen on the CT scan. So we can, I think, move on.
Okay. Yes.
And now the pre-procedural phase is over. And we can start the bronchoscopy.
Yeah.
And ti chiedo adesso di guardare di là.
Tesoro. Tesoro. Tesoro.
So Dr. Candoli will employ the ultra-thin bronchoscope to navigate to the lesion. And then we hope we can confirm the localization of the lesion with the radial EBUS probe. It's a subsolid lesion, so we expect to find a blizzard pattern on...
maybe.
Maybe.
We don't know now.
We expect to.
We expect, maybe.
We hope we'll find. Spiegagli tu cosa deve inquadrare adesso. Ok.
Give me the radial EBUS, please. Now we insert the radial EBUS, trying to see if we are very close to the lesion, but I don't expect a pattern of a solid nodule, but maybe this one. The blizzard image and maybe little small atelectasis maybe, but we are inside this part. Okay. So, we remove the radial EVAS. Yes.
Facciamo la pinza.
And forceps, please. Pinza. Now we perform a biopsy with the forceps for the ultra-thin bronchoscope. It's very small. Apri.
Vogliamo...
Chiudi. Close. Now via. Okay.
Vieni... No, facciamo che prendi per la...
We are forming the slide for the rows now at this moment. So,
okay. So,
okay.
Now the sample...
Yep.
Yes, question
Yes.
from the audience.
Yes.
Yeah. You can connect the body vision system to every rotatable C-arm, or you need a specific rotatable C-arm.
Credo che... sorry, the question is that if LungVision can work with every...
Fine.
Yeah, you need a special brand for the C-arm, or you can use that with GE, with Siemens, with Fuji, whatever. Or
yes,
is there a dedicated arm needed?
I think that is ready for with every platform of fluoroscopy, with every fluoroscope. There is no limitation. At the moment they... Vogliamo fare un...
Sì, un tool in lesion. Facciamo un tool in lesion.
Okay, now we want to check with the tool in lesion function if the tip of the forceps are within the lesion. So we have to perform a new CABT. Okay, now Dr. Candoli has put the forceps within the lesion and we perform an additional spin, fluoroscopy spin.
Dimmi quando vado.
Io ci sono.
Vado.
Ok. Ok.
Forse non ci siamo.
Cosa?
Forse non ci siamo.
Però...
We are performing the tool in lesion, but we are waiting the reconstruction of the machine in this moment.
Ok. È la mano tua, bravo. Ok.
Un po' di riflesso della scialitica. Ancora un po'.
This is lesion.
We are not inside.
We are not inside the lesion. We are close, but not inside. So we try to
Okay.
Now we just perform a short sweep to see if the tip of the scope is closed and in plane with the lesion, and it seems to be there. So now we take once again the forceps. Meanwhile, the first sample is being analyzed by the vivascope, and as soon as we know something, we will tell you.
Okay. Apri, open. Good, close. Vediamo se facciamo un tour.
Okay, we now perform a new CABT to check for the tool lesion.
Hello?
Okay, right. For the tool lesion relationship. This time it seems that we are in. Okay.
There's a window behind.
So once again, on CABT image, we have to select the target, and then the software. Okay, we are closer than before, not in. We are adjacent, but not in.
Give me radial libas, please. Della sonda radiale. Dopo preparo la crio. I go down with the radial ibus again.
Cosa mi metto il primo? No.
Okay.
Prima vediamo cosa viene.
Okay, here we have maybe some bleeding.
Yeah.
And please up, yes. Okay. Okay, stop. E alla pinza, so se faccio ancora.
Facciamo le trio, però bisogna cercare di centrarla un po' più.
Facciamo? Siamo molto lontani?
Sì.
Molto.
No, non molto, no. Per cui possiamo provare.
Sì, esatto, esatto.
Ok. Sì.
Come? Aspetta.
Senti la fra cosa ho visto, bene?
Oh? Here we are. Apri, open. Chiudi. Andiamo con la crio.
Sì, attivate, provate.
We now will perform cryobiopsy.
Okay.
Because we are adjacent to the lesion, but not really inside the lesion. We know that we have not a bronchus sign, so maybe with cryo can perform a good biopsy. So I hope.
Yeah, very good decision, yeah. To take the cryo where you get bigger specimens, especially when you do not have really center
Yeah.
Evo signal.
Yes. We are performing rows and evaluation of the biopsy with the vivascope. So we are ready for the cryo.
So there's a question from the audience regarding the radiation load when you have to rotate the C-arm. So how high is the radiation load for the patient and for the
So the
team?
patient is 700 centigrade per centimeter, okay? 700 centigrade.
Okay.
Yeah?
No, io ti schiaccio il fluoro, tu schiacci.
Vai. Prima facciamo un controllo bilaterale. Ok? Ok, diamo un'occhiata. Ok? No? No, no? Ok? Dammi. Ok. Ricontrollo?
Okay, so we check with the augmented fluoroscopy that we are in lesion or next to. And now we perform a two-scope technique, that is to say Dr. Candoli will perform the cryo
Ok, andiamo.
with 6 seconds.
Vai. 1.
1, 2, 3, 4, 5, 6. And I will go inside with another scope to check for bleeding, and it's mild bleeding. So there is no need to wash or...
To be nervous, yeah.
Okay, so we can collect another sample.
Yeah. I think the great pro for the body vision is compared to all other navigation technologies, you don't have additional costs because you don't need specific consumables for the body vision system. It's just the machine and the hardware and the software, but not additional costs per procedure.
Yeah. It's a low-cost technology because we use our instruments that we have inside our room, and so we have only the cost of the machine, but not other.
Okay. No, ok.
Aspetta.
Si spiega. Non faccio adesso.
Okay. No? Don't go.
Sì.
Bisogna vedere. No? No. Devo andare dall'altra parte. We have some bleeding, but... Ok. Ok, dai. Vediamo. Ok. Ok. In the cryo, please.
while we are performing another cryo, you see on the screen the preparation of the sample for the confocal scanner microscopy, the ex vivo.
So, Piero and the Bologna team, unfortunately, we're reaching the end of our time slot because we have to move. I think we have seen in a very nice way how we can use the body vision system to get access to lesion without any bronchosign, and you also showed nicely how the how the EBO system will help us. So thanks a lot to Bologna, great show, and I wish you a relaxing weekend, and hopefully you were able to get the diagnosis for the patient, so maybe you can inform us later. So thanks a lot to Bologna. Enjoy your weekend. Great show. And
thank you so much.
All the best.
Thank you. Thank you
Bye
so
bye.
much. Bye bye. See you.
Bye.
See you next time. Bye bye.